Hello, my name is Tim George. I am the clinic director here at Egoscue of San Diego. And in this video, we're going to cover a very simple evaluation tool that you can use to identify imbalances in your posture, as well as cover some simple exercises that you can do to help correct your posture. So make sure that your volume is high, you got room to move around as we go through this simple evaluation tool and exercises. All right, now from shoulder pain to ankle pain and everything in between, the Egoscue method has been helping people live an active and pain-free lifestyle through better posture. Now, it's important to understand that the way we view pain here at Egoscue is as a signal, or your body's voice, alerting you to something that needs to be addressed. And at Egoscue, the way we address that pain signal is not by focusing on the site of the pain, but rather focusing on an individual's posture, treating that body as a unit. All right. Now, let's first talk about what it means to have good posture. All right. So let's go ahead and look at a diagram of the human body. This diagram is what we call the blueprint of the human body, or the design of the human body. Our body was designed to be balanced. It was designed to be symmetrical. When we deviate from this design, from this blueprint, it's going to put stress on our body, limit our movement, and possibly bring about some type of pain. All right. Now, if you're one of those people that live with pain on a regular basis, the question that I have for you, is it possible that the pain you experience on a regular basis is being caused, or at least contributed to, by your body being out of alignment, or in other words, having bad posture? All right. So let's go ahead. I want to go through this evaluation tool now. I'm going to bring in a wonderful therapist here at the Egoscue Clinic to help. Her name is Marianne Berry. So Marianne, come on in here. Marianne's going to help us go through this self-evaluation tool. And first thing we need to do is go ahead and stand up, kick your shoes off. Nice. Perfect, perfect. What I'd like Marianne to do, and all of you to do watching this video, is just stand with your feet in a nice, comfortable position. All right. I want you to go ahead and close your eyes now. And once you close your eyes, I want you to really get a feel for the weight distribution in your feet. Do you feel balanced from right to left? All right. Do you feel more weight in the right, more weight in the left? Now just focus on the weight in the right foot. Where is the weight in the right foot? Is it in the heel, the ball of the foot, the inside edge, the outside edge of the foot? Now compare that to the left foot. Is it the same? Is it different? Now, so for some of you, you might be like, it's hard for me to really tell where my weight is. I feel like I'm swaying from side to side or back and forth. That is okay. Any imbalances that you're feeling in your weight distribution, or any swaying back and forth, side to side, we can safely conclude that that's telling us that your body has deviated from that blueprint, from that design. All right, there's some postural imbalances in your body. All right, now I want you to really, make a mental note of those imbalances, because we're going to retest this after we go through some very simple exercises to help correct those postural imbalances. All right, how about you, Marianne? Did you feel any imbalances, or are you pretty balanced? Okay. Now, first exercise we're going to do, we call these arm circles. We want to get our feet in the right position first. So go ahead, I want you to get your feet a little bit closer together. All right, you do this at home as well. You want your feet probably about 4 to 5 inches apart, and you want to turn your toes in just a little bit, almost to the point where you feel a little pigeon-toed. I know it's going to feel weird for a lot of you, but you always want to have your feet in this position. For the arm circles, once we get our feet set up, we're going to get our hands in the right position. The first thing we're going to do is we call this the golfer's grip. All right? So Marianne and me, we're going to curl the tips of our fingers down into our top of our palm there. Thumbs extended. That's what we call the golfer's grip. All right? So you want to try to get as close to that position, and then bring your arms out to your side at shoulder level. All right? So you're at shoulder level here. You'll want to squeeze your shoulder blades together behind you. Keep those shoulder blades together. Arms out straight. And Marianne's going to start by doing some circles going forward. She's going to do 40 of them, and you're going to do 40 of them. All right? You want to go with a little bit of pace, a little bit of speed. All right? Circles should be about 6 inches in diameter. All right? You're going to do 40 of them going in this direction here. Now, if it starts to bother your shoulder, your neck, you can lower the arms a little bit. Sometimes that can help take some strain off the neck, off the shoulders. All right. Again, keep those shoulder blades pinched and the hands in the golfer's grip. All right, good. Now we're going to do a second set. Now for the second set, I'm going to have Marianne turn so we can see her side view, so we can talk about some of the things to also watch for when you're doing this. Same setup, golfer's grip with your hands, arms out to your sides at shoulder level. Your shoulder blades are pinched. Okay, now for the second set, you're going to rotate your arms so those palms are pointing to the ceiling, and then your circle is going to go the opposite direction. All right, and again, we're doing 40 here, keeping the shoulder blades pinched, and about 6-inch diameter of the circles. One of the things you want to be aware of is you don't want to let your hips bail forward as you're doing these. See how Marianne starts to bail her hips forward? If you feel you're doing that, or if you notice that you're doing that, you want to try to correct that. Keep those shoulders, hips, knees, and ankles, everything stacked. Probably almost a 40 there, right? Okay, good. So those are the arm circles. All right, so once you're done, shake it out. All right, check your foot position. Make sure your feet stays in that nice 4 to 5 inches apart, maybe a little pigeon-toed. For the next exercise, we call this one elbow curls. We're going to use that same golfer's grip. And what you're going to do is you're going to put that flat part of your knuckle right up there on your temples. Perfect. All right. From here, what you're going to do is I want you to bring those elbows in front of you. Try to touch them if you can. If you can't, just get them as close as you can, and then open them up as far as you can. And you're going to repeat that for 25 reps. All right, just going in and out like that 25 times. You want those elbows to touch maybe a little bit below chin level. All right, and make sure that you take it through that full range of motion, all the way back and all the way forward with those elbows. Again, you're doing 25. Again, one of the things you want to make sure of here is what I was showing you on the side view. Don't let those hips bail forward. Keep everything from the shoulder, hip, knees, and ankles, everything stacked vertically. And remember to breathe in all these exercises. These are exercises that can be demanding, and at times you might notice you're holding your breath or tensing up your stomach muscles. You want to breathe normally. Keep those stomach muscles relaxed as you're going through these. Nice job. Good, good. Now, if 25 is too much, you can start with 10, you can start with 12. Do what you feel your body can handle, all right? If you can't do all the sets and reps that we're doing here, just, again, take what your body will give you. Nice work, nice work. 25, good. All right, shake it out again. And we're going to do one more exercise. The last one we're going to do is called a standing overhead extension. So again, first thing, check that foot position. 4 to 5 inches apart, maybe a slight pigeon toe position with your feet. And then you're going to interlace your hands. Good. And then push your palms out away from you, elbows locked out like that. Okay, good. And then you're going to bring those arms straight above your head as high as you can go, keeping the arms straight. All right. And then let your shoulder blades, or excuse me, these muscles on top of your shoulders, let them relax. You don't want to be raising those shoulders up towards your ears. Try to just let those shoulders relax down and look up towards your hands. You're going to hold this about a minute. All right, and then you want to make sure, again, the elbows are straight. Good. Your stomach muscles are relaxed. You're breathing. Again, breathe normally. Don't hold your breath here. Again, from a side view, make sure that you're not letting those hips bail forward. Think about shoulder, hip, knee, and ankle. Everything staying stacked vertically. About halfway through here, got another 30 seconds. Again, though, if you can't get your arms as high as Marianne has hers, just go where your body can go. Yeah, I'm okay if your arms are there, or if your arms are straight above your head, anywhere in between. That's fine. You, again, take what your body will give as you're going through this minute here. Got about 10 more seconds. You okay? All right, good, good. And good. Go and relax it down. Again, shake it out. Nice job. Nice job. Now that we've done those 3 exercises, go ahead and get back into just a normal standing position. Kind of let your feet go where they naturally feel they want to go. Just maybe shake out those shoulders a little bit. Go ahead and close your eyes again. Close your eyes and get a feel for that weight distribution in your feet that we tested a few minutes ago. Go ahead and notice what feels different now. Do you feel more balanced? Do you feel more grounded in your feet there? Do you feel less swaying side to side or back and forth? For a lot of you, there is some difference there. You feel more balanced. You feel more grounded. If you're having some type of ache and pain, wherever it might be, get a feel for that. Has that changed? Has that gotten better or lessened? All right, you can go ahead and open your eyes. All right, what happened to you? Any change?
Yes.
You're not just making that up?
For real.
All right, good,
Yeah.
good. So when we get the right stimulus, those exercises, it's amazing how quickly the body is going to respond. And by just doing some exercises to help get your body closer to that blueprint, closer to that balanced, symmetrical position, it's going to take stress off your musculoskeletal system, allow your body to move more effortlessly, and eventually, reduce that pain or limitation that you might be dealing with. All right, thanks. Thank you very much. Now, if you enjoyed this video and you found it helpful, please make sure you click the like button below or subscribe to our YouTube channel. If you want more information about the Egoscue Method Therapy, please visit our website, or you can, of course, call the clinic or email the clinic directly and talk to myself or one of the other incredible therapists here at Egoscue of San Diego. Thank you for watching.